Hello everyone and welcome to our Monday Minute. Today we're going to discuss the clarifications surrounding occupational therapists being allowed to conduct a start of care comprehensive assessment. Effective January 1st of 2022, occupational therapists are now permanently allowed to conduct the start of care comprehensive assessment when it is a therapy-only referral. So occupational therapy and or physical and speech therapy must be ordered. Occupational therapy can not be the standalone qualifying skill to admit a patient into home health services. It has been a long-standing rule in Medicare home health that occupational therapists could not be the standalone qualifying skill, and that continues. However, occupational therapists are allowed to conduct that start of care assessment when it is a therapy-only referral. One of the big issues surrounding the understanding home health agencies have of this rule is when can occupational therapists stand alone in a home health episode if they can't be the only skill at the start of care. So there was clarification a couple of years ago regarding the fact that if physical therapy opened the case, for example, occupational therapists could do an evaluation, then physical therapy would have to do at least one more visit in order for occupational therapy to stand alone. So basically we were talking a sandwich type situation where a qualifying skill opened the services, occupational therapy did an evaluation, a qualifying skill did another visit, and then occupational therapy could stand alone. When questioned about that process during the final rule leading up to January of 2022, CMS clarified that the order of the services was no longer an issue, but if occupational therapy was conducting the start of care assessment, they must establish that there is a qualifying skill for an additional service in order for occupational therapy to continue care. So if occupational therapy is conducting the start of care assessment, following that assessment, there would need to have been an established qualifying skill for another discipline during that assessment, and then another evaluation or an evaluation visit would take place by a PT or ST, and then after those evaluations, occupational therapy could stand alone. Occupational therapy has always been able to conduct recertification assessments and continue in recert episodes alone, and that has not changed. We want to thank you all for participating today. We do want to remind you that we did a therapy documentation blog recently that you should have all of your therapists review. We also want to let you know that if you need any additional clarifications regarding occupational therapy or their ability to conduct the start of care comprehensive assessment, please don't hesitate to reach out and let us know. We hope you have a fabulous week.